Right now, a WESH 2 Investigates exclusive on the ransomware attack on a local hospital system. Several employees say the data breach at UF Health in the Villages and Leesburg Hospital is negatively impacting patient care. Those staff members are now talking only to WESH 2 investigative reporter Greg Fox.
You know, God forbid we administer something that we thought was ordered or wasn't ordered and something happens and there's a bad outcome.
David, who doesn't want us to reveal his identity, is an employee of UF Health. On May 31st, according to memos obtained by WESH 2 Investigates, there was a cybersecurity event. Two cybersecurity firms I spoke with say it appears to be a ransomware attack in which a phishing email is sent to a staff member, and when opened, system records are locked and remain inaccessible until money is paid. Since then, employees are using pen and paper and phone calls to keep and share records. Both David and another employee we'll call Andrea tell us without access to patient computer files, knowing what drugs to give and what allergies to avoid is challenging.
These are critically ill patients. They are the sickest of the sickest, and they are on life and death type of medications.
We are missing medications that are due. I personally have talked to other people who said patients were getting one medication when a different one was ordered.
Because the two campuses affected in the UF Health chain, the Villages and Leesburg, are on different and older computer systems, hospitals have to call pharmacies to get patient prescription histories. Another problem, according to these employees, long delays in getting lab reports. In a June 8th daily update on what the system is calling Operation Restore, one of the hot items is reminding medical staff it is very important that the right lab reports are placed in the appropriate patient's chart. In an email to WESH 2 Investigates, UF Health said it responded quickly with the suspension of all computer access and email, suspension of computer connections between UF Health and the University of Florida, adoption of paper documentation, and coordination of health care with other providers. While declining to be interviewed or to answer our questions about the effect on patient care, a spokesman told me, as a team of dedicated and caring medical professionals, we understand that at its core, healthcare is about people taking care of people, and we remain committed to continuing to provide exceptional care to our community. In his June 3rd letter to employees, the hospital chain CEO said he does not believe any patient or personnel records have been compromised or shared. Our experts tell us it's likely too early to know that for sure. In Leesburg, Lake County, Greg Fox, WESH 2 News.
A UF Health spokesperson would not say when he believes that data breach will be contained and computer access restored. He also would not confirm if an older computer system at the Villages and Leesburg hospitals would be replaced with newer systems used at other UF Health campuses. There's still no word as to whether UF Health intends to pay ransom to the hackers. We'll keep you posted.